Question 1. Topic: Anesthesia and analgesia when monitoring a patient under anesthesia. You observe that the capnograph shows a sudden and significant decrease in end-tidal co-echo. Which of the following could be the most likely cause? A. The anesthetic machine is leaking. B. The patient has developed a cardiac arrest. C. The patient is experiencing hyperventilation. D. The oxygen flow rate is too low. Answer: B. The patient has developed a cardiac arrest. Explanation: a sudden decrease in end-tidal co often indicates a severe reduction in cardiac output, such as in cardiac arrest. When the heart stops, it no longer delivers carbon dioxide from the tissues to the lungs, leading to a sharp drop in echo levels. A. Incorrect. A machine leak may cause an inadequate supply of anesthetic gas but would not directly affect echo levels in this way. C. Incorrect. Hyperventilation decreases co gradually, not suddenly. D. Incorrect. Low oxygen flow would affect oxygen delivery, not directly cause a sudden echo drop. Relevant guidelines. Monitoring during anesthesia should follow standards such as the American College of Veterinary Anesthesia and Analgesia (ACVA) recommendations, which emphasize the importance of tracking echo as an indicator of ventilation and perfusion. Question 2. Topic: Workplace practices and communication scenario-based. You are working in a busy veterinary practice when a client, Mrs. Thompson, arrives visibly upset because her cat has been misdiagnosed during a previous visit. She raises her voice and accuses the practice of negligence. What is the most appropriate action for you to take in this situation? A. Apologize immediately and offer a refund for the previous consultation. B. Ask Mrs. Thompson to calm down and lower her voice to avoid disturbing other clients. C. Listen actively, acknowledge her concerns, and assure her that you will escalate the matter to the veterinarian for further clarification. D. Explain that the practice cannot be held responsible for every misdiagnosis and stand by the previous diagnosis. Answer: C. Listen actively, acknowledge her concerns, and assure her that you will escalate the matter to the veterinarian for further clarification. Explanation: effective communication in veterinary practice involves demonstrating empathy and professionalism when handling complaints. Listening actively and acknowledging the client's feelings show respect and concern. Escalating the matter to the veterinarian ensures the issue is handled appropriately. A. Incorrect. Offering a refund without investigating the situation may be premature and can imply fault. B. Incorrect. Telling the client to calm down may escalate the situation further. D. Incorrect. Dismissing the client's concerns undermines trust and professionalism. Relevant guidelines. The Australian Veterinary Association AVA Code of Professional Conduct stresses the importance of transparency, active listening, and conflict resolution in veterinary settings. Question 3. Topic: Emergency and critical care. During a veterinary emergency, a dog presents in shock. Which of the following clinical signs would most likely indicate hypovolemic shock? A. Bounding pulses and warm extremities. B. Pale mucous membranes and prolonged capillary refill time (CRT). C. Cyanotic mucous membranes and increased respiratory effort. D. Hyperemic mucous membranes and ischusite. Answer: B. Pale mucous membranes and prolonged capillary refill time (CRT). Explanation: hypovolemic shock is caused by a significant loss of circulating blood volume, leading to poor tissue perfusion. Clinical signs include pale mucous membranes, prolonged CRT, 2 seconds weak pulses, and tachycardia. A. Incorrect. Bounding pulses and warm extremities are more typical of early distributive shock, e.g. sepsis. C. Incorrect. Cyanotic mucous membranes suggest severe respiratory compromise, not directly hypovolemia. D. Incorrect. Hyperemia and ischus-CRT are seen in distributive shock, not hypovolemic shock. Relevant guidelines. Emergency protocols such as the Recover Initiative, Veterinary Emergency and Care Society provide a standardized approach to identifying and managing shock in veterinary patients. Question 4. Animal care and welfare. Which of the following approaches is the most effective strategy to minimize stress in a hospitalized feline patient? A. Placing the cat in a kennel close to barking dogs. B. Handling the cat frequently to ensure it acclimates to human contact. C. Providing the cat with a hiding place and using pheromone sprays. D. Keeping the cat in a high traffic area to promote environmental desensitization. Answer: C. Providing the cat with a hiding place and using pheromone sprays. Explanation: cats are highly sensitive to stress in unfamiliar environments like veterinary hospitals. Placing the cat near barking dogs or in high traffic areas. D. Exacerbates stress due to noise and visual stimuli. Frequent handling, be it without necessity, can increase anxiety. Using hiding places and feline pheromone sprays like Feliway C mimics cat's natural coping mechanisms, promoting relaxation. This approach aligns with animal welfare principles and stress reduction strategies. Question 5. Veterinary pharmacology. Scenario question. Emma, a veterinary nurse, is preparing a medication for a 5 kilograms dog. Veterinarian has prescribed a drug with a dosage of e.g. the available drug concentration is 10 ml. How much of the drug should M administer? A 0.5 ml, B 1.0 ml, C 2.0 ml, D 2.5 ml. Answer: B 1.0 ml. Explanation: to calculate the correct dose, determine the required dosage TGS 5 kg equals calculate the volume needed. Dose concentrate. He was in GAEB 1.0 ml. Incorrect answers arise from miscalculating either the dosage or the conversion. Accurate calculations are essential to prevent underdosing, A, or overdosing, C, D, which could lead to therapeutic failure or toxicity. Question 6. Diagnostic techniques. What is the most appropriate method for obtaining a sterile urine sample in a dog for bacterial culture? A, free catch urine collection. B, manual expression of the bladder. C, catheterization or cystosynthesis. D, collection of urine from the kennel floor. Answer: C, catheterization or cystosynthesis. Explanation: for bacterial cultures, sterile techniques are crucial to avoid contamination. Free catch and manual expression. B, introduce environmental bacteria, rendering the sample unreliable for culture. Collecting from the kennel floor. D, is inappropriate due to inevitable contamination. Catheterization or cystosynthesis. C, directly accesses the bladder under aseptic conditions, ensuring sample sterility and diagnostic value. This approach adheres to infection control guidelines. Question 7. Emergency and critical care scenario question. During triage, a client rushes in with their dog, which has pale gums, rapid heart rate, and difficulty standing. The dog was hit by a car. What should the veterinary nurse prioritize? A, place the dog in a kennel for observation. B, begin CPR immediately. C, provide oxygen and initiate intravenous fluid therapy. D, perform a thorough physical exam before any treatment. Answer: C, provide oxygen and initiate intravenous fluid therapy. Explanation: the dog's symptoms suggest shock likely due to internal bleeding or trauma. Administering oxygen Romanuid stabilizes critical parameters like oxygen delivery and blood volume. Placing the dog in a kennel A or delaying treatment for a physical exam. D, wastes valuable time. CPR. B, is not indicated unless the dog experiences cardiac or respiratory arrest. Following triage principles ensures appropriate care in emergencies. Question 8. Anesthesia and analgesia. What is the primary purpose of pre-anesthetic medication in veterinary patients? A, to increase the duration of anesthesia. B, to ensure complete sedation before surgery. C, to reduce anxiety and minimize the required dose of anesthetic agents. D, to eliminate the need for monitoring during anesthesia. Answer: C, to reduce anxiety and minimize the required dose of anesthetic agents. Explanation: pre-anesthetic medications reduce stress and anxiety in patients, which facilitates smoother induction of anesthesia and lowers the dosage of general anesthetics. Reducing side effects. Increasing anesthesia duration is not the primary goal. Pre-anesthetic drugs may not ensure complete sedation. B, as their effects vary. Monitoring is required. D, during anesthesia, regardless of pre-medication use, to ensure patient safety. Question 9. Surgical nursing. During aseptic preparation for surgery, which of the following is not an appropriate action? A, wearing a sterile gown and gloves. B, clipping and cleaning the surgical site before scrubbing. C, touching sterile equipment after adjusting your mask. D, ensuring all instruments are sterilized before use. Answer: C, touching sterile equipment after adjusting your mask. Explanation: maintaining asepsis requires avoiding contamination of sterile equipment. Touching your mask introduces microorganisms to the gloves, violating sterility. Wearing proper attire, preparing the surgical site. B, and using sterilized instruments. D, adhere to aseptic principles. Deviations can lead to surgical site infections, compromising patient outcomes. Question 10. Vaccination protocols. Which of the following is the best practice when administering a rabies vaccine to a dog? A, administering the vaccine in the lateral abdomen. B. Injecting the vaccine in the interscapular region. C. Giving the vaccine in the right rear limb below the stifle. D. Administering the vaccine intravenously for rapid action. Answer: C. Giving the vaccine in the right rear limb below the stifle. Explanation: best practices for vaccine administration ensure easy identification of the injection site in case of adverse reactions. The rabies vaccine is commonly administered in the right rear limb below the stifle for consistent placement. Interscapular injections B are discouraged due to difficulty in identifying post-vaccine complications. Intravenous administration D is inappropriate for vaccines. Question 11. Parasitology. Which diagnostic method is most effective for identifying Giardia in a canine fecal sample? A. Direct smear. B. Fecal flotation using zinc sulfate. C. Behrman technique. D. Sedimentation technique. Answer: B. Fecal flotation using zinc sulfate. Explanation: Giardia cysts are best identified with fecal flotation using zinc sulfate. Direct smears A may detect trophozoites but are less reliable. The Behrman technique C is used for larval parasites, not protozoa. Sedimentation D is more suited for detecting heavy parasite eggs, not Giardia. Proper diagnostic methods improve accuracy in parasite identification. Treatment. Question 12. Zoonotic diseases. Scenario question. A veterinary nurse is assisting a veterinarian during an exam for a feral cat brought in for spaying. The cat scratches the nurse, and the veterinarian suspects the cat may be infected with Bartonella henselae, the causative agent of cat scratch disease. What is the nurse's next step? A. Clean the wound thoroughly and report the incident. B. Ignore the scratch unless symptoms develop. C. Apply a bandage and immediately return to work. D. Take antibiotics as a precaution without consulting a doctor. Answer: A. Clean the wound thoroughly and report the incident. Explanation: cat scratch disease can be transmitted through scratches or bites. Thorough cleaning reduces the risk of infection. Reporting the incident ensures proper documentation and follow-up. Ignoring the scratch B or simply applying a bandage C may delay necessary medical intervention. Self-prescribing antibiotics D is inappropriate. A treatment decision should involve a healthcare. Question 13. Nutritional management. A client reports that their dog has been losing weight despite an increased appetite. Which nutrition-related condition should the veterinary nurse suspect? A. Diabetes mellitus. B. Chronic kidney disease. C. Hypothyroidism. D. Osteoarthritis. Answer: A. Diabetes mellitus. Explanation: weight loss with an increased appetite is a hallmark sign of diabetes mellitus due to the body's inability to utilize glucose effectively. Chronic kidney disease B often causes weight loss but typically decreases appetite. Hypothyroidism C is associated with weight gain and lethargy. Osteoarthritis D is unrelated to appetite changes. Proper nutritional assessment helps identify metabolic conditions. Question 14. Radiology. What is the primary safety concern when taking X-rays in a veterinary clinic? A. Overexposure to ionizing radiation for the patient and staff. B. Mislabeling of the X-ray images. C. Poor positioning of the patient for the image. D. Inadequate sedation of the patient. Answer: A. Overexposure to ionizing radiation for the patient and staff. Explanation: ionizing radiation poses significant health risks, including potential damage to living tissues. Protective measures such as lead aprons, gloves, and thyroid shields are essential for staff safety. Mislabeling B or poor positioning C affects diagnostic quality but does not pose a health risk, while sedation D may be necessary for certain cases. Safety. Radiation is the top priority in radiology. Question 15. Client communication. Scenario question. A client is upset because their dog developed a skin infection after being groomed at a clinic. They demand answers and appear angry. How should the veterinary nurse respond? A. Apologize immediately and accept full responsibility. B. Tell the client infections are common and dismiss their concern. C. Listen calmly, validate their concern, and explain the next steps to address the issue. D. Suggest the client find another grooming clinic. Answer: C. Listen calmly, validate their concern, and explain the next steps to address the issue. Explanation: effective client communication involves listening empathetically and validating concerns to de-escalate situations. Offering a plan to address the problem builds trust. Apologizing without understanding the facts A or dismissing the concern B could worsen the situation. Suggesting another clinic D is unprofessional and fails to resolve the issue. Question 16. Anesthesia monitoring. While monitoring A dog under general anesthesia, the veterinary nurse observes a sudden drop in blood pressure. What should be the first step? A. Increase the vaporizer setting. B. Decrease the intravenous fluid rate. C. Notify the veterinarian immediately and assess for potential causes. D. Administer epinephrine without consulting the veterinarian. Answer: C. Notify the veterinarian immediately and assess for potential causes. Explanation: a sudden drop in blood pressure during anesthesia is critical and can indicate complications such as hypovolemia or excessive anesthetic depth. The nurse should alert the veterinarian and work collaboratively to identify and address the cause. Increasing the vaporizer setting, A, or decreasing fluids, B, can exacerbate the issue. Administering epinephrine without proper evaluation can be harmful. Question 17. Infectious diseases. Which of the following diseases is caused by a spirochete and commonly transmitted through contaminated water or urine? A. Parvovirus. B. Leptospirosis. C. Toxoplasmosis. D. Distemper. Answer: B. Leptospirosis. Explanation: leptospirosis is a bacterial infection caused by spirochetes and is transmitted via contaminated water, soil, or urine from infected animals. It can affect multiple organ systems. Parvovirus A and distemper D are viral diseases, while toxoplasmosis C is a parasitic infection. Understanding transmission pathways is crucial for prevention and control. Question 18. Pain management. Scenario question. A cat that underwent an orthopedic surgery is showing signs of aggression and hiding. What should the veterinary nurse consider as the most likely cause? A. Post-surgical euphoria. B. Fear of staff and unfamiliar surroundings. C. Pain from the surgery. D. Normal post-surgical behavior for Answer: C. Pain from the surgery. Explanation: behavioral changes like aggression and hiding are common indicators of pain in cats. Adequate pain management should be evaluated and adjusted if necessary. Post-surgical euphoria A is rare and fear B may contribute but is less likely the primary cause. Normalizing this behavior. D risks overlooking pain and delaying appropriate treatment. Question 19. Pharmacology. Which of the following medications is classified as an NSAID and commonly used to manage inflammation in dogs? A. Carprofen. B. Gabapentin. C. Amoxicillin. D. Tramadol. Answer: A. Carprofen. Explanation: carprofen is a non-steroidal anti-inflammatory drug NSAID used to reduce inflammation and pain in dogs. Gabapentin B is a neuropathic pain medication. Amoxicillin C is an antibiotic, and tramadol D is an opioid-like analgesic. Proper drug classification aids in selecting the right treatment. Question 20. Fluid therapy. What is the primary purpose of administering lactated ringer solution ARS during surgery? A. To maintain hydration and electrolyte balance. B. To deliver a source of nutrition to the patient. C. To enhance oxygenation of tissues. D. To prevent infection at the surgical site. Answer: A. To maintain hydration and electrolyte balance. Explanation: lactated ringer solution is an isotonic fluid commonly used during surgery to maintain hydration, electrolyte balance, and adequate perfusion. It does not provide significant nutritional support. B. Or directly enhance oxygenation. C. Infection prevention. D. Is unrelated to fluid therapy but involves aseptic techniques. Question 21. Parasitology. Which of the following external parasites is most commonly associated with the transmission of Lyme disease? A. C. Tennosphalides Feles flea. B. Ixodes scapularis deer tick. C. Sarcoptes scapit mite. D. Autodex cyanotes ear mite. Answer: B. Ixodes scapularis deer tick. Explanation: the deer tick Ixodes scapularis is the primary vector for Lyme disease caused by the bacterium Borrelia burgdorferi. Fleas A. Can transmit other diseases. Mites C. Cause mange and ear mites. D. Affect the ears but are not associated with Lyme disease. Question 22. Surgical instruments. What is the primary use of Metzenbaum scissors in veterinary surgery? A. Cutting bone and cartilage. B. Cutting delicate tissues. C. Holding needles during suturing. D. Clamping blood vessels. Answer: B. Cutting delicate tissues. Explanation: Metzenbaum scissors are designed for precise cutting of delicate tissues during surgery. Cutting bone or cartilage. A. Requires instruments like bone cutters. Needle holders. C. Are used for suturing, while clamps. D. Are used to control bleeding. Question 23. Nutrition. A client asks for a diet recommendation for their dog recovering from gastrointestinal upset. What is an appropriate suggestion? A. High-fat, high-protein diet. B. A diet rich in fiber and raw foods. C. A bland diet such as boiled chicken and rice. D. A diet with increased salt content. Answer: C. A bland diet such as boiled chicken and rice. Explanation: a bland diet like boiled chicken and rice is easy to digest and helps soothe an irritated gastrointestinal system. High-fat or raw diets, say, B, can exacerbate issues, and increased salt, D, is unnecessary and potentially harmful. Question 24. Zoonotic diseases. Which of the following diseases is zoonotic, meaning it can be transmitted from animals to humans? A. Feline leukemia virus (FEL). B. Canine distemper. C. Rabies. D. Parvovirus. Answer: C. Rabies. Explanation: rabies is a fatal zoonotic disease transmitted through bites or scratches from infected animals. Feline leukemia A and distemper B, a species-specific, while parvovirus D affects dogs and is not zoonotic. Question 25. Anesthetic complications. Scenario question. During surgery, a dog under general anesthesia begins to exhibit shallow breathing and a prolonged capillary refill tide (CRT). What is the most appropriate initial action for the veterinary nurse? A. Administer a bolus of intravenous fluids. B. Decrease the anesthetic gas concentration. C. Apply mechanical ventilation without consultation. D. Notify the veterinarian and assess for anesthetic depth or hypovolemia. Answer: D. Notify the veterinarian and assess for anesthetic depth or hypovolemia. Explanation: shallow breathing and prolonged CRT are signs of inadequate perfusion or excessive anesthetic depth. The veterinarian should be notified immediately to evaluate the cause and adjust treatment. Administering fluids A or reducing anesthetic gas B may be appropriate after assessment. Mechanical ventilation C requires veterinary approval. Question 26. Pain management. Which of the following is an appropriate method to assess pain in a hospitalized animal? A. Observing the animal's body posture and behavior. B. Checking vital signs such as heart rate and respiratory rate. C. Using pain scoring system tailored to the species. D. All of the above. Answer: D. All of the above. Explanation: pain assessment in animals involves a combination of behavioral observation, physiological monitoring, and pain scoring systems. Recognizing subtle signs of pain is essential for effective management. Each method provides complementary insights into the animal's condition. Question 27. Aseptic technique. What is the primary purpose of performing a surgical scrub on the hands and arms before surgery? A. To sterilize the skin completely. B. To reduce the risk of post-operative infections. C. To clean visible dirt and debris only. D. To avoid contamination of the surgical site entirely. Answer: B. To reduce the risk of post-operative infections. Explanation: a surgical scrub reduces the microbial load on the skin but does not sterilize it entirely. A. This minimizes the risk of infections during surgery. Cleaning dirt C is part of the process but not the primary goal. Contamination avoidance D is achieved through additional measures such as wearing sterile gloves. Question 28. Animal behavior scenario question. A client brings in their cat Luna, who has recently started urinating outside the litter box. After a physical exam reveals no underlying medical issues, what is the most appropriate next step? A. Recommend changing to a new type of litter box. B. Suggest behavioral modification and environmental enrichment. C. Prescribe antibiotics as a precaution. D. Advise rehoming the cat to reduce stress. Answer: B. Suggest behavioral modification and environmental enrichment. Explanation: when no medical issues are present, inappropriate urination often results from stress, environmental changes, or litter box aversion. Behavioral modification and environmental enrichment are the most appropriate interventions. Changing litter boxes might help, but addressing stress is more comprehensive. Antibiotics C are unnecessary without evidence of infection. Rehoming D should only be a last resort. Question 29. Pharmacology. Which of the following is the most accurate way to calculate the drug dosage for an animal? A. Use the recommended dose from a general chart without adjustment. B. Estimate based on the animal's size and weight. C. Calculate using the animal's exact weight and the drug's concentration. D. Administer the same dose for all animals of similar species. Answer: C. Calculate using the animal's exact weight and the drug's concentration. Explanation: dosages must be carefully calculated using the animal's weight and the drug's concentration to avoid over or underdosing. General charts or estimates B. may lead to errors. Standardized doses D. disregard individual variations such as metabolic rate or health status. Question 30. Diagnostic imaging. What is the purpose of using a collimator during radiographic imaging? A. To enhance the contrast of the image. B. To reduce the radiation dose to the patient and staff. C. To prevent scatter radiation from reaching the X-ray detector. D. To magnify the area of interest on the image. Answer: B. To reduce the radiation dose to the patient and staff. Explanation: a collimator restricts the X-ray beam to the area of interest, reducing unnecessary exposure to surrounding tissue and limiting scatter radiation, enhancing contrast and preventing scatter on the detector. C. As secondary benefits, collimators do not magnify images. D.